Okay, so much anticipation. Welcome everyone to Past, Present, and Future, Women Leading the New York City Health Department. I'm Jenna Mandel Ricci, Chief of Staff in the Office of the Commissioner, and really delighted to be with all of you here today and everyone online. Today's event is the culmination of our year-long celebration of the New York City Health Department's 220th birthday. It has been a year of connecting back to our legacy and mission, of reminding ourselves of our resilience and creativity across the ages, and of celebrating all the ways we have contributed to the health and well-being of our beloved city. I can't think of a better way to end this year's festivities than with this panel celebrating our fierce and brilliant female commissioners. Before I introduce them, I'd like to celebrate the one female commissioner who is not with us today, but who blazed the trail for the women who are. Maybe we can hold up. That is Dr. Leona Baumgartner. She was the agency's first female health commissioner, serving from 1954 to 1962, and she was a true pioneer and arguably one of the most effective and impactful commissioners of the 20th century. Dr. Baumgartner established programs in research and preventive medicine. She revised the New York City Sanitary Code and raised funds for the Public Health Research Institute. She was a master of health communication, giving regular talks on television about public health topics. And she was instrumental in testing the polio vaccine and leading mass inoculation efforts in New York City, including the very famous vaccination of Elvis Presley in 1956, which garnered unprecedented media attention. You can read more about her and all of our panelists in today's program, which is available via the QR code that I think is on these signs right here. Now I would like to introduce today's panelists and who are already up here. Together, they represent over 100 years of public health experience. And more than that, and 13 years at the helm of this agency. First, I'd like to introduce Dr. Peggy Hamburg. She's an internationally recognized leader in science, medicine, and public health. She's currently co-president of the Inter-Academy Partnership. Dr. Hamburg served as New York City Health Commissioner from 1991 to 1997, where she undertook major initiatives to address HIV/AIDS, curtailed the resurgence and spread of TB, and launched the nation's first public health bioterrorism preparedness program. After her time as New York City Health Commissioner, she served as Assistant Secretary for Planning and Evaluation at the U.S. Department of Health and Human Services and as FDA Commissioner. Dr. Mary Bassett is Director of the Francois Xavier Bagnoud Center for Health and Human Rights and FXB Professor of the Practice of Health and Human Rights in the Department of Social and Behavioral Sciences at the Harvard T.H. Chan School of Public Health. From 2014 to 2018, she served as New York City Health Commissioner, where she made racial justice a priority and worked to address structural racism at the root of the city's persistent gaps in health between white New Yorkers and communities of color. Dr. Bassett also led the department's response to Ebola, Legionnaire's disease, and other disease outbreaks. And from 2021 to 2022, Dr. Bassett served as New York State's Health Commissioner. Dr. Oxiris Barbot is President and CEO of the United Hospital Fund. From 2018 to 2020, she served as New York City Health Commissioner, leading the city's response to the first wave of COVID-19. Her strategic decision-making, early action to address racial inequities, and clear and effective communication in both English and Spanish made a significant difference in public understanding, rapidly flattening the transmission curve and addressing the needs of the most vulnerable in our city. As commissioner, she was also the driving force behind the city's launch of a home visiting program for first-time families. And of course, today's panel will be moderated by our current fierce and brilliant commissioner, Dr. Michelle Morse.
You guys can a good sign that I'm already getting emotional. That's with the bios. That says that this is a conversation that's just meant to happen, and it couldn't happen at a more perfect time. And just so thankful to Jenna for all the planning and for such a great introduction and warm up for a conversation that I've been looking forward to for quite some time. So thank you to my fellow commissioners. It is just an honor to get to share the mic with you. And I'm going to ask you some hard questions, so get ready. And we are going to have a little bit of time at the end for questions from the audience as well. So thank you everyone who's made the time to be here, both in person and online, including another former commissioner who we have to give a shout out, Dr. Dave. Also, thanks for being here. So with that, what a moment we are in public health. I wanted to start the conversation with a really open question to all of you. There is so much happening, both on the federal, state, and local landscape for public health. There's so much happening when it comes to civil rights and human rights. There are so many profound challenges that we're facing in public health, both being undermined at the federal level and misinformation, quite frankly, taking root logarithmically, with all of the challenges that we face. And in the spirit of trying to help us as leaders and as an agency focus our efforts, I'm curious if you could just tell us and reflect a little bit on what you are paying attention to in this moment. Where is your mind at? What are you focusing on in the morass, frankly, that is the public health context in our city, country, and world right now? And maybe I'll ask Dr. Hamburg to go first, since she is our, let's say, most experienced person on the panel.
You can definitely say most senior. And, it is sort of ironic for me to be back in the beating heart of the health department, in that I was, I think, the youngest person ever appointed as health commissioner. And now I am clearly the senior citizen of this group. And in that role, I think what I'm really focused on the most is, how are we going to rebuild? What is the path forward? What is the next chapter? We're not going to go back under the best of circumstances, or even any imaginable circumstance, to the status quo ante. The world is different for many, many reasons. The institutions that many of us have worked for decades to build are, severely damaged in many ways. The systems that we depended on, the truths that we believed in, all of those things have been under fire and questioned. So the landscape is dramatically changed, and we need to think about the path forward, and it's going to be different, but we have an obligation to really be as thoughtful as possible and take from what has been this chaos and crisis the elements that can be positive and rebuild, with a real eye towards what are the critical needs and opportunities. How can we harness the best of both science and humanity, to do a better job? It's a little bit optimistic, perhaps, that we can come out of this better, but we have a real responsibility to do our very best. In the meantime, I think for people working here, there's a huge responsibility to do your job and do it well, and sort of not let the current context make you feel impotent, or that the work you do doesn't matter. In fact, it matters more than it ever has before. And in some ways, you're really lucky, because in all of this chaos and in all of this period of uncertainty, so many people are sort of grappling with, how do I respond? What do I do? Well, what you do really matters, and do it as well as you can, and with optimism and energy, because that is also how we move forward.
Thank you for just reminding us that change is one of the few constants, right? That we have to be prepared for it, and that it's actually very encouraging to hear that you're already thinking about the rebuilding phase in the future. So thank you for that, Dr. Bassett.
Well, this is really going to be fun to to participate in this conversation. Let me try and answer this question, which is a very sweeping one, in two ways. One is to acknowledge that we're in a historical period that is truly unprecedented. And by that, I'm not just talking about the threats to public health. I'm talking about the threats to democracy. And that's why there's a reason to be really excited about the next mayor and the hope that he represents for standing up against forces that are legitimately or not seeking to overturn the advances that made my working life possible. By that, I'm talking about the advances of the civil rights movement. And so that's a context that I think we should acknowledge. But you've also asked, how we bring this lens to specifically to public health. And I couldn't agree more that I can't think of any other field where you can go to work every day and be confident that you are doing something good. And that is truly a gift. So I hope you all keep that with you. But more specifically, what I'm thinking about and tracking, because I think you asked that, are the really catastrophic cuts to health insurance coverage that are in the pipeline, the cuts to Medicaid, the cuts to the abandonment of the attempt to undermine the Affordable Care Act and the Essential Health Plan, which many of you may not even have heard of, which New York State pioneered. Only 2 states took up this option. And in the next 2 days, we're having a committee meeting of the group that we all look to for guidance on immunization practices that seems likely to do real harm, continued harm to recommendations on vaccination. So those are the things that I'm watching in the newspaper. And those are the things that I know the voices are here to speak out against. And I know that, we can't take on the project of protecting democracy, as a public health project alone. But we should never pass up on the opportunity to link the role of public health to the protection of democracy. So I think about that too.
Spoken like a human rights professor. So thank you. And thank you for, again, reminding us of the broader context in which public health is happening. We've been starting some conversations about what has the legacy of public health been in peace and anti-war activities as well as democracy. So I'm sure we'll get more into that. Thank you. And Dr. Barbot, should we switch? Let's switch seats because
I'm happy to switch.
Sorry.
No worries.
Don't forget.
Yes, that's important. My food.
All right. Good. So I think there are 2 things that I'm paying attention to, and one builds on what Dr. Bassett was just saying, and it's how the cuts to Medicaid are going to affect communities, but more sort of big picture than that, how it's the most visible part of the spear that's being used to attack poor people in this country, and how that then starts to disintegrate the way in which communities think about how we take care of one another, right? And the existential threats of that yes, encompass democracy, but I think go far beyond that. And the role that public health has to play in ensuring that when we talk about immunizations, when we talk about the importance of Medicaid, we talk about it from the perspective of how that contributes to social justice in this country. Social justice being one of the roots of the birth of public health in this country. So I think about those things. The second thing I think about, and I'm keeping an eye on, is public health authority and the degree to which public health is quote unquote allowed to do its job, and the tools that it has to use it to have at its discretion are allowed to continue. For example, post-COVID, we've seen many states roll back public health authority, not just for immunizations, but for responding to outbreaks and other things like that. And so I was recently at Somos and I got to give a talk on, vaccinations. And I took the opportunity being with a bunch of, state legislators to say, don't take for granted that what we have in New York State is always going to be, because you never know what the next election is going to bring in, right? And so the fact that we were able to pass removal of religious exemptions when we had the last measles outbreak in New York State, that the department was critical in getting past. I always remember with working with Brad Hoylman at the state, like that was critical. And so there are states that are rolling that back, and we can't in New York State take that for granted, and New York City has to be a leader in that. And so thinking about not only what are the things that we need to pay attention to, like vaccinations and Medicaid, but what is the larger role of public health, and continuing to have the health department be a leader in that space.
That's very sobering. And
Winter is coming.
yeah. and just what we need to hear. And also a great segue to my next question. With our collective 100 years of experience here, let's take a moment and look back. And the three of you led this city, this agency, in such important times as well, and navigated so many challenges. I guess there's no time when public health is not challenging, but I do want to ask you if you could just share with us some of your reflections looking back at your time as commissioners, and what your most significant challenge was during your tenure, and then how your experience being a woman commissioner may or may not have played into that challenge. And I'm going to go back to Dr. Hamburg, and now we're kind of in order. So,
well, you embedded a lot of questions in that one question. And it's always hard to pick out, one thing as well. As I mentioned, I was young when I first became commissioner. I also was inexperienced, to be frank. I'd come into the health department as a deputy, and then sort of suddenly was made acting commissioner. I hadn't even been here a year, but that was, I'd never really, until I became the deputy, I'd never really managed any large group or anything, and I hadn't worked in New York City. So being a woman and being young, both were challenges, and being, relatively new to public health. But my first big challenge sort of set the stage for everything else. And when we were meeting in a smaller group, I mentioned it briefly, but I came in at a time of a budget crisis and a real crisis of morale within the agency. And, my first act was both to figure out what was the budget that had been proposed when I came in that was full of things that were completely unacceptable, eliminating the immunization program, the school health program, the TB program, many things that just could not be implemented. And I was sort of stunned to see, what it was. But my first act was to go to the mayor and the corporation council. I don't know if they still call it corporation council, and lay out why these cuts could not be taken and ask for an immediate redress of that problem, and then to lay out what I thought was actually needed for the future. And in many ways, that sort of standing up for the department, and it became very public because the Board of Health was very concerned when I went to them with my concerns, and they wanted to declare, or at least some of them, a state of emergency, which had all kinds of legal implications as well. But for me, that was a crisis. I was the acting commissioner. I didn't think I would be the commissioner. I didn't want to be the commissioner, if the truth be known. But one thing it taught me was, that you have to do what you think is right. You have to speak truth to power, so to speak, and you have to act in support the agency or department that you're leading. And I think it laid a foundation for me to both lead with trust and support within the department, but also established my credibility as a leader to the rest of the New York City community. And so that was for me personally, having never been in a leadership role before, to suddenly sort of take on this thing that I thought was so important and so weighty, was both shaped me as a person and as a leader, but I think also was an important credibility step. In terms of legacy, I think one of the most important things that I undertook was addressing the TB crisis. And I do want to take another minute just to discuss that, because I think it also taught me something very important about governance, something that isn't often replicated, but we and the use of data. We had been sitting on a powder keg for a long time in New York City, and if you went back and looked at the reports coming out of the TB unit within the health department, every year they were tracking the serious and worsening burden of disease, TB, in the poorest, most underserved pockets of the city. But actions weren't being taken. In fact, they almost closed all the TB clinics, as one example. But so we weren't acting on data. And we weren't concerned about a problem that wasn't as broadly perceived as a problem for everyone. But then, we also learned that we had drug-resistant TB, which, made the problem even more urgent. But I went to the mayor and I explained the problem that we were facing. And he did something that was really quite extraordinary. This was Mayor Dinkins, and I think I don't think he ever got credit for some of the really good things he did, but he was a mayor that listened to his appointees and the people he had trust in. And he viewed me as an expert, for better or for worse. And he said, if you think this is, a really serious problem facing the city, I will fully support you in what you need to get done. And we put together a strategy. It was a fairly straightforward strategy with 3 key points. He sponsored and came to kick off a 3-day meeting where all of the different partners that were needed to address TB in the city came, both within government and external to government. We all got on the sort of same page with what the problem was and how it needed to be addressed and the different roles of the partnership. He made me a name tag, which I have to today, that said, Dr. Margaret Hamburg, MD, TB Czarina. But he gave me control of the budget for all of New York City TB activities. So Rikers Island, the homeless shelters, the Health and Hospitals Corporation. And initially, everybody was extremely upset. They thought, that I was going to take all the money for the health department. In fact, we got the least percentage-wise, I think, because the drivers of TB and the context for TB spread were outside of the traditional health agencies. It was the homeless shelters when we moved from big armory style to apartments, Rikers Island, and the criminal justice system, where people were going in and out of that system, but in and out of TB care. We set up programs for directly observed therapy, et cetera. We trained doctors to even think about TB, et cetera. But I've said more than enough. But this idea of integrating the work of the health department into the broader life of the city and activities of so many critical domains for health, but that hadn't been thinking of themselves as part of both the problem and the solution. And, and it underscored for me the importance of strong political support for action.
That is Amazing. Thank you for sharing that reflection. And I'm so glad we're recording this because I'm going to need to watch it again. And I have a feeling this advice is going to come in handy very soon for us. As I mentioned, Dr. Frieden was here a couple months ago talking about his book where you featured as one of the superheroes. Really,
I have to read that book.
yeah. Really protecting the city from tuberculosis. So thank you. Dr. Bassett.
You know, I was living in Zimbabwe at the time that you became the health commissioner for New York City. And we heard about the work that you were doing in New York City around tuberculosis in the global arena, where, of course, TB was also taking a terrible toll. So the work that New York City does really is not just known to nationally, but spreads around the globe. So I think we were supposed to start out with challenges. I had been a deputy commissioner under Tom Frieden, and I led all of the non-communicable disease work on all of it underfunded, by the way, at the New York City Health Department. I remember in my first weeks as a deputy commissioner, I was told to eliminate our maternal and child health program, if you can believe that, which we did not do, as you all know. But I came out of that experience, and I actively wanted to be the health commissioner. So I applied online, so I different from you, Peggy, and
qualified.
And I remember one of the first things that came up were Dr. Frieden, his thing was tobacco control. Dr. Farley, his thing was sugar sweetened beverages. What's your thing, Dr. Bassett? And I said, well, my thing is equity. And they were like, what? That is not a thing. What are we going to do with that? So I faced that challenge of trying to put into place a way of thinking within the health department that embedded equity in all the work that we did. And in New York City, it is impossible to talk about equity without talking about racism. And I also brought that word to the work of the health department. It was virtually absent in the previous administration. So that was a challenge that I faced. People were like, this is too foggy. We can count up the number of smokers. We can, talk about sugar sweetened beverages. How are we going to measure equity? And so I was steadfast in that. And I remember quoting something that I think somebody famous said this, and I can't remember who it was, but not everything that matters can be measured, and not everything that we measure matters. And this is really critical to the health of all New Yorkers, that we get right. So I had to defend the position that I took. And I guess moving to legacy, I would say that, we got to do lots of really great work. We didn't shy away from clinical service provision, opened more, the first round of school-based health centers since the Dinkins administration, sort of boosted the, what became the sexual health clinics, did a lot of work that engaged with the clinical space, and also policy work. But what really remains with me is my proudest accomplishment, I think, all of you in the room can tell me if this is true, is embedding within enough people in the health department the notion that the pursuit of equity is the pursuit of excellence, and that we cannot do public health well unless we consider the huge gaps that exist within our population that are completely preventable. And then there's have I covered enough of this question? I don't know if there was more. We did not have budget cuts, by the way, which I don't think well, certainly you faced immediately, and I think every commissioner who followed me had to face. And we squeezed that budget so that we spent all of the funds that were made available to our department. And I guess as part of the most kind of programmatically visible part of the equity agenda was the neighborhood work and the embedding within the health department, not only the structure of what are now called neighborhood health action centers, but that every part of the health department should direct its most costly programming to the communities that had the highest needs that were not related to bad behavior of the people who lived there, but to the failure to give people adequate resources for healthy lives. So I'd say that all of those.
That's a word. And I just have to say, I never would have been interested in coming to the New York City Health Department if it hadn't been for your work. I often say that Dr. Bassett put out a bat signal to everyone who cared about racial equity and health equity. And when I had the opportunity, I certainly answered the call, but it was really because of that work. So thank you. Dr. Barbot?
We kept it going.
Indeed. Reminds me when I'm supposed to cover.
Yes, absolutely. I mean, again, like, can we turn this into, I don't know, a podcast or something? But yes, if you could talk about one of the biggest challenges you faced as commissioner, and if relevant, how being a woman commissioner in particular. Yeah. It's okay. It'll come up. It'll come up. May or may not have played.
We have 3 of the 5 women who in the entire 225-year history of this department have led this agency. 3 of us are here out of the 5 right now.
Well, 1 in spirit, 4. Right. So I will definitely talk about that, but what I want to just sort of add to what Dr. Bassett said, one of the reasons why I left my job as commissioner of Baltimore City to come to New York as first deputy was to work with her on this mission and journey of instituting health equity throughout the department. And it was one of the best decisions I ever made. So, so challenges, I don't know what you're talking about. Yeah, so I'm going to say something that you probably won't expect, and then I'll say something else they probably won't expect, but I'm going to go there. So I think for me, and probably for all of us and you as well, it's the challenge of not letting fires get in the way of what it is that you actually want to do, right? Because when I came into this job, I was acting, and I don't know, the first day I was acting, there was a plane that came in from the Middle East, and I got a call, you know, we think there might be MERS on this, so, you know, let's mobilize the city. And that was at like 8:30 in the morning, and by 5 o'clock news, like, it had been handled. And I'm like, whoa, okay. And then, you know, the largest measles outbreak in the last 30 years, and I'm not even going to talk about COVID, right? So I think the challenge for me was keeping in mind what it was that I wanted to accomplish in this job and not letting anything get in the way of that. And recognizing that sometimes what you can get accomplished doesn't happen in your tenure, it happens after your tenure, right? And so for me, I think one of the biggest things was the home visiting program, right? Like, I spent my time as first deputy commissioner. Sometimes I felt like torturing staff on, like, you know, let's refine this and get this down. And how do we, you know, how do we get this to a place where it can be funded? I used my political capital when I was deputy commissioner, pissed a lot of people off, but like got it on the mayor's, you know, state of the city and got it going. And so I think to what degree being a woman or not being a woman of color or not sort of played in that tenacity, right? Like you got to keep in mind what the goal is, no matter what the obstacles are. I think probably had a lot to do with that. You know, clearly the biggest challenge I had was being commissioner during the first wave of COVID. And I always say that I was in the middle of the storm when de Blasio was mayor, Cuomo was governor, and Trump was president. Right? Like that's a mic drop. And so one of the lessons I learned was that, you know, we go into these jobs, we pursue these jobs or not, because we feel like we know what we're doing. We're qualified, right? But I soon came to realize it didn't matter that I had been commissioner in Baltimore City. It didn't matter that I had been public health practitioner for the previous who knows how many years. It didn't matter that I was in the middle of H1N1, the last pandemic that the country was in. None of that mattered. And it became very, obviously, very political. And so I think, you know, what also I leaned on being a woman of color is not being afraid of speaking truth to power. Got all over the news, but that's okay, right? Because it was worth it. And so, you know, the other thing is knowing who your friends are and who they're not, and not being worried about that. Understanding how ambition can sort of, you know, color things. So I think that being a woman and a woman of color in this position during that time was a definite asset. And though I would not want to be back there again, I think it certainly changed me for the better, made me stronger. And the one thing I will say is that you think about all of the men who, you know, came after me in one way or the other. Where are they now? And where am I?
Well, yeah,
One of them I think
we
is
can
in
stop
jail.
now. End of conversation. Yes. So powerfully stated. Thank you. Thank you for that. I mean, I am taking vigorous notes and just so appreciative. These are like unbelievable pearls of wisdom, and thanks to all of you just for sharing what is like a very personal reflection as well. I do have a couple more questions, and we're doing great on time, and I expect the audience probably has a few questions in mind as well. We'll turn to you guys shortly, but let's come back to right now. We have a mayor-elect who went from 1% to 51% in a matter of 10 months or something like that. Unprecedented. Absolutely unprecedented, and happening in a time when so much feels dark and not possible. That certainly presents the New York City Health Department with an opportunity, and certainly also a lot of challenges. It's clear that New York City is going to be targeted by our federal government as well. All of that said, let's talk about the opportunity. So we are about 3 weeks away from inauguration of our new mayor. We have a lot of transition planning in a very short amount of time. And the narrative and the platform so far of our mayor-elect is very exciting, but doesn't specifically name health or public health, as has been pointed out by many folks. How can we show that public health has to be a part of the solution and the success of the 4 years of our mayor-elect? And I'll go back to you, Dr. Hamburg, to kick us off.
Well, I'm probably the least qualified to discuss this because I haven't been living in New York City for decades, and I wasn't following the campaign and Mayor-elect Mamdani's positions as closely as I'm sure all of you have. But I was surprised that he did not talk about health and I was disturbed by that. And I thought it can't really be true. I must have just missed it because I've been at a distance, because, you know, all of the values housing, the discussion is certainly about affordability, you know, all to me resonated of health issues and needs. And so I think that, you know, the key now for you and your leadership role and for the betterment of New York City is to get him to recognize that he really is a public health person, and he just hasn't been recognizing it, and he hasn't been talking about that, but that so much of his agenda revolves around health issues. Both he's talking about drivers of health, and, you know, and that is a hugely shared value and goals for, you know, people of every stripe in New York City. But also all the things he wants to accomplish depend on a healthy population. And, you know, I think certainly for me, when I, you know, going back to the 90s, I worked 3 years under Mayor Dinkins, 3 years under Mayor Giuliani. And I was surprised yet again in my professional career to be asked to stay on. But I thought it was important because to me, it demonstrated that the health department is a professional agency and that our work should be done based on the best public health practice and not on politics. That, of course, is a little unrealistic and increasingly unrealistic in the modern era. But, you know, so I did, you know, gladly stay on, but I also recognized that I needed to change how I sort of promoted the work of the health department with leadership at City Hall. With Mayor Dinkins, you know, we talked a lot about what mattered for underserved populations. And, you know, we began to address the issues of equity, although we didn't use that exact label back then. With Mayor Giuliani, I knew that wasn't going to be the one. And talk about public health as a form of public safety. And you know, it took a while for that to sort of penetrate, but, you know, I think it made it a difference. And I think, you know, how you frame the role of the health department and its work and its interconnection with so many of the other issues that he has been focused on and wants to push forward, that I think you can really make a difference. Part of it is getting in front of him, and part of it is, you know, is having your elevator speech, so that, you know, with all the different competing priorities and messaging that he's, you know, going to be hearing, you know, that you, and I think giving examples of what has worked, why it has mattered, and why it would be critical to his success at implementing his vision.
Thank you for that. Even though, as you mentioned, maybe you haven't been paying attention, that is solid foundational advice. So thank you for those words, and to you, Dr. Bassett.
So I guess we're giving advice, I suppose, to everybody here and to you. The first thing to say is that soon to be Mayor Mamdani is going to be coming into office with a list of commitments that all of you can repeat, because they were so crisp and clear that you know that it's going to be childcare from 6 weeks, freezing the rent, focus on making healthy food more affordable through subsidized supermarkets in each borough. I think it's one per borough, and the free bus routes. So these things are things that will all improve public health. And I think, Peggy, you've said this, and I know that we were talking about it earlier, that these are all part of being a public health mayor. And I would not start out by saying you left out public health. I would start out by saying everybody who works in public health knows that your agenda will be good for the health of this city, and support him in implementing this extremely ambitious agenda, which can be delivered. And so in that, I would suggest, in addition to honing your elevator speech, whatever that means, I don't know, that you think about ways in which you can build health into some of the commitments that he's made. How do you make sure that you can show the health impact? Because certainly the childcare would be one of them, right? I don't know this. Could you show that the children who are in childcare have higher rates of being fully vaccinated, for example? Or I don't know, you can think of these things. And the other is, putting in place the kind of ability to measure impact, which that would be one example of. I always regretted that with the pre-K program, for which we will all be honored to have served the de Blasio administration, that we didn't do more around health for those little children. And trying to figure out what could go into building into the expansion of this program, a health lens. It's not going to work to say, give me another $2 billion or whatever. Or probably even not 2 million. I'm not sure where the budget's going to be, but I would not make my first request to one of, give more to the health department. I would frame it as the health department would like to support your agenda. So, yeah, you lived through a really interesting transition. And I think we, now since I have the mic, I need to say a few words in support of David Dinkins as well, who is very undervalued as a mayor. And but that was a very interesting. I never participated in a transition. I actually live in Boston now, so I also am not really, part of the swirl of things, although you probably know that both Dr. Barbot, Dr. Daskalakis, Dr. Easterling, and I are on the Mamdani Health Transition Team. So the hearing from all of you, which I hope we'll have a few minutes for, will be really useful. Yes.
Thank you for that. Yes, Dr. Barbot, last word before we open it up to the audience.
Yeah, so I will take what was said and just go in a little bit different direction, because I don't think I could say it any better. What I would sort of remind you of is he's bringing in a new agenda for the city, which is great. And we're excited to be a part of trying to make that come to life. And I echo and underscore what the two of them said. But at the end of the day, you need to remember that he's still a politician, and that politicians in this city respond to headlines. And part of what I think would make the health department even more successful in helping him advance his agenda is being ready for when the headlines may not be so favorable, and provide opportunities to address those headlines and to say, we have a potential solution, right? Because there were a couple of times during our tenure where we were able to provide potential solutions. I was going to say solutions. I don't know that they were solutions, but they were you need to be opportunistic, right? You need to figure out how is it that you can advance the agenda of the health department while at the same time helping him advance his agenda. Sometimes they'll overlap and sometimes they won't, and that's okay. But, being as adept as possible at using language to get your stuff done and make it seem like it fits squarely into what, he's trying to promote is an art that sometimes, we're successful at and sometimes we're not. But I think having the savviness to do that and instill that in, the deputy commissioner level, the assistant, instill that down the chain of command, I think is important, because it then makes the organization as efficient as possible.
All right, another mic drop moment. Yes, thank you for that. And thank you for the
I'm not in
honesty.
government anymore. I can say what I really think.
We love it. We love, this is amazing. Really just, sure.
You know, I think that the value of communication, so when I started out in public health, communication wasn't so much of a focus. It sort of had to be done, but it wasn't a driver of what we did and how really as much as today. And, you know, so I watched the evolution of 24-hour care. I remember when New York One started. And, you know, and it's changed something. And the challenge, I think, is so much harder now.
Yes.
Because in my day, we could control the narrative. When there was a crisis, I held the press conference every day to update the press and the city about what was happening and what was next. Now you're always a little bit behind. And so I think, you know, the nimbleness of the communication and recognizing how much headlines can drive action and thinking, for better and for worse. I mean, I'll just say it helped me with my TV issue with City Hall when the New York Post had a front page story, killer TV on subway.
Totally.
Right. But I just think the whole role of communication, I know you have an able crew here, but it's just so much more important than it's ever been. And it's also a part of restoring public policy and understanding of the role of public health, why it matters, and restoring trust and confidence on a daily basis and in crisis.
Thank you for that. Again, so glad we're recording this. This is just unbelievable advice. Okay, so we have time for probably one or two questions from the audience. I know we also have a number of people online, and perhaps there may be online questions. Anyone in the room want to go first? Awesome.
Thank you so much. This was really incredible. And I'm glad I got to sneak in. I didn't get a seat. Hi, everybody. I'm Cassie Toner. I use she pronouns. I worked closely with both of these amazing women, so I'm really excited to hear all this. And what I just want to make a shameless plug for, because I now 6.5 years have been in the Division of Mental Hygiene, is not to forget about mental health. I think there's actually quite a concerning agenda for this mayor, in my opinion, around mental health and putting it in a community safety context. And I know, Dr. Bassett, you did a ton of work, and we actually lost the correctional health services because of the work focused on the criminal legal system and really calling out injustice and violence in that system. And I have a lot of concerns about this, you know, sort of conflating of violence with people who have mental illness. And so just any thoughts you have on that, and on, you know, if you have any chance to influence that committee, that'd be great.
Well, we agree, right, that there has to be a focus on mental health. And you know, the New York City Police Department is massive. I don't know the numbers that are in my head are ones that are from a while back, but there were 36,000 patrolmen on the streets. And so the idea of this much smaller community safety agency having to offset that, and I'm sure that many responding police officers would much prefer somebody else to handle calls to respond to emotionally distressed people. But it just, I can't help but notice the difference in the size of these two entities. And key to it would be winning the support of the police department in this. And I don't know, you know, we'll have to see. This is a campaign promise, so it's going to happen. So I think trying to think through how the department can contribute to the negotiations to make it successful will be the right thing. You brought up the loss of health department oversight of health services on Rikers, and that is something that I should have listed among the challenges that I didn't get the outcome I wanted. And the charter authority of the health department is still there. Let me just end with that.
Another mic drop moment. And thank you for the question, Cassie. And if I can put a part B, we got an online question that kind of follows suit, that kind of asks for you, Dr. Hamburg. You kind of balanced public health and public safety during the Giuliani administration. And the question from our online person was kind of, how did you balance those things without marginalizing marginalized communities? And yeah, how?
Well, okay. It was an effort to first engage him with public health and understand, why it mattered, what was a secondary concern, something just, or so it's first getting in front of him why public health mattered, and the threat of tuberculosis was one, and not just that it was a public safety issue, because the TB program that Dinkins started continued into the county, but also the importance of public health to the economic security of the city. In terms of the underserved populations, to be blunt, I didn't emphasize that a lot because I didn't think that was going to be what motivated him. I thought that if we could sort of get the critical programs for public health that he could understand in terms of the things that were his priorities, that we could also benefit all populations. But I didn't think, that pointing out the excessive burden of tuberculosis in our poorest communities was going to be what motivated him. It was going to be, that this is a problem that is a threat to all communities and we need to fix it together. Or this is a problem that's going to undermine our economic productivity, or we need to have systems of public health so that if someone releases a biological agent in the city as an act of terrorism, we can, have the systems to detect it early and respond. So, you can't, I think,
It's the art of it.
do it all at
Yeah.
once.
Yeah, no, and all of you just described so beautifully the art of public health. And for that, I am profoundly appreciative. We are almost at the end of our time. I'm gonna take moderator's privilege and ask these incredible commissioners to close us out in a way that I think prepares us for the new year. I've been asking this of many of the people we've hosted here at the Health Department, but it is our 220th birthday this year. And to have been around for 220 years is a feat. And it is a particularly interesting and difficult time in public health, despite these 220 years. So if you'd be willing to share a final brief birthday wish for the New York City Health Department to close us out, would appreciate that. And maybe this time I will start with Dr. Barbot.
Sure. Well, I feel like this should be on an electronic birthday card, right? So my wish for the health department is for it to remain the beacon for public health across the country, and for it to continue to attract young, motivated public health practitioners, cultivate them in their careers, and then continue to have them populate public health across the country, so that we then, and we talked about this a little bit when we were here, we then get to sort of export and seed our values across the country. And I think that's a great legacy for the department to continue to have.
I think one of the real strengths of this department is that it's seen as its supervising authority, the people of the city, and to continue to meet the mandate to protect the health of all people in this city, to recognize that addressing these huge and preventable differences in health across populations is something that protects us all, and to continue that legacy. I realize that we haven't talked much about the federal threat. And so that's not part of birthday wishes, obviously. But I think that grounding our work in the data and using it to drive policy is part of the enduring legacy of this department. And happy birthday, 220. That's pretty cool.
Well, I don't have much to add and we don't have much time, but I guess I would, underscore a couple of things. One is, let's face it, New York City Health Department is the greatest health department in the country and the world. Must continue that great history and tradition and legacy. The impact, as was just noted, is huge. And as we look to the next 220 years, let's not get old and stodgy. Let's keep doing what matters. Let's keep translating knowledge and concern into real world action. Let's keep getting our hands dirty, and let's keep working on the most important problems that people face, which is, protecting and promoting health.
Nothing else needs to be said. Thank you so much. And I hope we get to do something like this again, because there's going to be a lot more to talk about. So thank you for being with us.